Carbon monoxide poisoning is caused by the inhalation of carbon monoxide created from improperly burning fuel indoors or in poorly ventilated areas. The gas is colorless, odorless, and tasteless, which can make it difficult to detect if you don't have a carbon monoxide detector installed in your home. On test day, you might come across carbon monoxide poisoning in the context of a patient attempting to commit suicide by sitting inside their car in a closed or poorly ventilated area, like a garage. In this video, we'll be discussing my visual mnemonic to help you remember the pathology, clinical manifestations, and treatment for carbon monoxide poisoning so you'll be ready to answer any question on test day. Oh no, what happened here? By the looks of it, our He-Man is knocked out and unconscious on the floor. At Pixarize, He-Man is our recurring symbol for hemoglobin. But I wonder why he's slumped against the car unconscious. As the town's only detective, it's my job to figure out the root cause of his condition. See this giant monocle I'm holding up to inspect the scene? I never go anywhere without my trusty monocle. Yeah, this monocle should help anchor you to this scene on carbon monoxide poisoning, since monocle sounds similar to monoxide. Get it? Monocle for carbon monoxide? Should be pretty easy to remember, so let's move on. Next, notice how our He-Man is slumped against this car in the garage, and it looks like the car's engine is on. This car is here to help you equate the car exhaust in the garage to carbon monoxide poisoning. You see, carbon monoxide is produced during the incomplete burning of organic matter. Other than fires, sources of carbon monoxide include poorly ventilated heating systems, fuel-burning devices, and motor vehicles, like this car operating in tightly sealed or enclosed spaces like warehouses or this garage. Poor ventilation of a home can affect multiple family members. So if you see a question stem with multiple family members presenting with similar symptoms in the dead of winter, try to keep carbon monoxide poisoning on your differential. Notably, you may encounter carbon monoxide poisoning in the context of a suicide attempt using a vehicle exhaust. Thankfully, our He-Man is the only person affected here, so we have less victims to worry about. Now, let's get back to my monocle. If it's not already clear to you, I'm pretty possessive of my monocle. I never go anywhere without it. In fact, it's helped me solve some of the most challenging murder mysteries known to man or womankind. Just to show you how possessive I am of my monocle, I'm clutching it tightly in my hand, as can be pictured here. This tightly held monocle should help you remember that hemoglobin has a much stronger affinity for carbon monoxide than oxygen, and the binding of carbon monoxide to hemoglobin creates carboxyhemoglobin. If you have a lot of carbon monoxide available, the blood will potentially carry carbon monoxide instead of oxygen, leading to decreased transport of oxygen to tissues. In addition, the binding of carbon monoxide to form carboxyhemoglobin decreases oxygen unloading at tissues. In combination, carbon monoxide poisoning leads to severe tissue hypoxia. The lack of oxygen particularly affects cells with high energy demand, like the basal ganglia. This is why bilateral globus pallidus lesions can be seen on MRI. As an additional point, myocarditis is also seen in some patients with carbon monoxide poisoning, and it is thought to also be caused by hypoxia. Let's take a step back to investigate the effect of carbon monoxide poisoning on the hemoglobin-oxygen dissociation curve. You see, not only does carbon monoxide displace oxygen from hemoglobin, it also changes the way hemoglobin interacts with oxygen. An increased concentration of carboxyhemoglobin in the blood causes the hemoglobin-oxygen dissociation curve to shift to the left. This happens because hemoglobin is a tetramer with 4 oxygen binding sites. When carbon monoxide binds to one of the binding sites, it increases the affinity of oxygen for the other binding sites, thereby causing the hemoglobin molecule to hold on to oxygen instead of releasing and delivering it to the oxygen-starved tissues. In other words, because of hemoglobin's increased affinity for oxygen, very little oxygen is actually released to the tissues. This causes hypoxic tissue injury. Decreased delivery of oxygen to tissues can also cause lactic acidosis. So, given all of the information on the oxyhemoglobin dissociation curve and carbon monoxide's impact on hemoglobin's affinity for oxygen, how do you think we should treat carbon monoxide poisoning? Well, take a look at this oxygen tank. This oxygen tank should help remind you that the principal treatment for carbon monoxide poisoning is 100% oxygen or hyperbaric oxygen. First, you need to immediately remove the affected person from the area in which they're being exposed to carbon monoxide fumes, and then you should give them the oxygen. You see, oxygen hastens the dissociation of carbon monoxide from carboxyhemoglobin, thereby making more hemoglobin available to bind more oxygen. This allows increased levels of oxygen to be delivered to tissues, reversing some of the symptoms we're going to discuss later on in this video. Next, notice this closed garage door over here. Of course the door is closed. How else would the carbon monoxide build up in here? Remember, carbon monoxide poisoning happens with poor ventilation, so this door is definitely closed. By the way, this closed door should help you remember the second pathophysiological mechanism involved in carbon monoxide poisoning, complex 4 inhibition. Because door rhymes with 4, duh. Recall from your classes that complex 4 is part of the electron transport chain. If it is blocked, aerobic metabolism is inhibited. Now, before we go on, I want to briefly mention the differences between carbon monoxide and cyanide poisoning. You see, while both toxins can lead to complex 4 inhibition and impairment of aerobic respiration in the tissue, the main problem here in carbon monoxide poisoning is not at the tissue, but in the blood. Yeah, the carboxyhemoglobin changes are the main culprit for hypoxia here, and the complex 4 stuff is really secondary. That's why treating with 100% O2 works for carbon monoxide poisoning. Contrastingly, in cyanide poisoning, the cyanide doesn't really affect blood, but instead hits the tissues hard. Cyanide is a far more potent blocker of complex 4 in tissues, and supplemental O2 does not help patients with cyanide poisoning. You will need to differentiate between these two on test day, so I really want to hammer this point home. Carbon monoxide poisoning hits the blood, while cyanide poisoning hits the tissue. Got that? Now that we've reviewed the pathophysiology and treatment for carbon monoxide poisoning, let's quickly go over the symptoms commonly seen in this condition. Remember how we mentioned how increased levels of carbon monoxide in the blood decreases hemoglobin's delivery of oxygen to the tissues? Well, this decreased oxygen delivery can manifest itself in nonspecific symptoms like confusion, headache, dizziness, and nausea. And what do you know? Our He-Man is clutching his head because of his throbbing headache. Just remember our He-Man clutching his head in pain to remember that carbon monoxide poisoning causes headache, dizziness, nausea, and other nonspecific findings. Similarly, take a look at the bright red cherry color of the car. This cherry red color should help you remember that patients with carbon monoxide poisoning often present with cherry red lips and skin. This is commonly described in the literature as a classic finding of CO poisoning, but it's only seen in about 2 to 3% of symptomatic cases. You see, carboxyhemoglobin has a characteristic cherry red appearance, meaning that its accumulation in the blood causes the skin or lips to turn that characteristic hue. Finally, let's discuss diagnosis for carbon monoxide poisoning. Take a look at our nurse over here. She's busy trying to revive He-Man from his stupor and has attached an oxygen monitor to his finger. This oxygen monitor should help you remember that in a person with carbon monoxide poisoning, pulse oximetry readings will be normal. You see, standard pulse oximetry, or SpO2, cannot screen for carbon monoxide exposure, as it does not differentiate carboxyhemoglobin from oxyhemoglobin. In fact, carboxyhemoglobin has a very similar light absorbance characteristic versus oxyhemoglobin, so they will both look like oxygenated blood to your pulse oximeter. But take a look at our He-Man coughing and choking on the fumes. His gagging should help you remember that even though his oxygen saturation levels appear normal on pulse oximetry, his actual oxygen content is extremely low. You'd be able to determine his actual oxygen content by administering an arterial blood gas, or ABG. That's exactly why our nurse has him hooked up to an oxygen tank. Way to go, nurse, you've saved the day. Okay, I feel pretty woozy now, and my head is starting to ache. Before I also inhale these carbon monoxide fumes, let's review the basics and get out of this garage. Carbon monoxide poisoning occurs when an individual inhales an excess amount of carbon monoxide. It is an odorless, tasteless, and colorless substance emitted from burning organic fuels, and it can be very difficult to detect. Carbon monoxide has a much stronger affinity for hemoglobin than oxygen. Its binding to one of hemoglobin's binding sites can cause hemoglobin to bind even more tightly to oxygen, thereby reducing oxygen unloading at the tissues. It can also inhibit complex 4 of the electron transport chain, although this is far less important than its role in the bloodstream. Clinical manifestations of carbon monoxide poisoning include headache, cherry red skin, myocarditis, and bilateral globus pallidus lesions on MRI. Pulse oximetry will not be able to detect carbon monoxide poisoning since it cannot differentiate between oxyhemoglobin and carboxyhemoglobin. But a follow-on arterial blood gas will reveal very low blood oxygen content. In order to treat this condition, one must administer 100% oxygen or hyperbaric oxygen to help shift the hemoglobin oxygen dissociation curve back to the right. Well, that's it for carbon monoxide poisoning. Quick, let's get out of here before we pass out too.